Hi there, my name is Laura. I'm from section 32, and I'm gonna be reading the chapters from 1 to 4 from the book Professional English in Use. The first chapter is called Health and Illness. Part A, Asking about Health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How's your health generally? If you are in good health, you are well and have no illness. Disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. And here we have some synonyms. For not ill is going to be healthy, fit and well, very well, and in good health. For ill is going to be unhealthy, unfit, unwell, not very well, poorly, in poor health. Part B, Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings. I was ill this morning. I felt unwell this morning. I vomited this morning. I feel sick. I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Recovery. When Part C, recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good, full, or complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb to get to talk about change. For example, get over an illness could be that means to recover, get better to improve, get worse to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, she remains in complete remission. Complete the table with words for need and be opposite. The first one has been done for you. The noun, fitness, adjective, fit, health, healthy, illness, ill, sickness, sick. Make word combinations using a word from each box. Look at B and C opposite to help you. Complete remission, feel sick, get over, poor health, travel sickness. Complete the conversation. Look at B opposite to help you. Doctor says, how are you feeling today? Patient says, not very well. Doctor, how long have you been feeling unwell? Patient, about a week. Doctor, what is your health like normally? Patient, very good. I'm usually quite fit and well. Doctor says, what is the problem now? It's my stomach. Do you feel nauseous? Yes. Have you actually been vomiting? No. Have you had any serious illness in the past? Or disease? No, none at all. Choose the correct word to complete this sentence. Look at B and C and opposite to help you. Her condition deteriorated and she died. He recovered and was allowed to go home from hospital. The cause of sleeping sickness was discovered in 1901. The patient made a full recovery. I have been in good health for months and feel very fit. It was a month before I got over the illness. He seems to be rather unhealthy. His diet is bad and he never exercises. Unit 2. Parts of the body 1. Part A. Parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions where doctors use the anatomical name. They are shown in brackets below. Jaw, mandible, neck, shoulder, armpit, axilla, upper arm, elbow, back, buttock, wrist, thigh, calf, leg, chest or thorax, breast, stomach, tummy or abdomen, navel or umbilicus, hip, groin, that is the inguinal region, knee, patella, that is the kneecap, chin. Limb means arm, upper limb or leg, lower limb. The trunk is the body excluding the head and limbs. For a more detailed diagram showing parts of the body, see Appendix 1 on page 130. Part B. Referring to parts of the body. When patients speak about their problem, they often refer to a part of the body. I'm having trouble with my hip, shoulder, or knee. The doctor often needs to ask about a part of the body. Do you get any pain in the chest, in your stomach, in your back? Part C. Describing radiation of pain. A patient is telling the doctor about his back pain in the parts of the body it radiates to. It starts in the back, then it seems to go into the right buttock, and down the back of the right thigh to the knee. Exercise 2.1. Write the ordinary English words from the corresponding anatomical terms in the table using your medical knowledge. Look at A opposite to help you. Anatomical term. Abdomen. The common word will be tummy. Axilla, armpit. Carpus, breast. Coxa, hip. Cubitus, upper arm. Mama is gonna be breast. Nate's buttock. Patella, kneecap. Complete the sentences using ordinary English words. Look at A and C opposite to help you. A male patient describing angina pectoris is like a tightness across my chest and it goes up neck, my jaw and into my left shoulder and goes down the left arm. A male patient describing renal colic. It starts in the loin and goes into the lower abdomen and down into the testicle. Complete the sentences. Look at A opposite to help you. Inguinal swelling. That's going to be the anatomical term, but the patient's statement would be, I've got a lump in the groin. Abdominal pain. My little boy's got a stomachache. A periumbilical rash. I got some spots around my around my navel. Thoracic pain. I got a pain in the middle of the chest. Enlarged axillary node. There's a painful swelling in my armpit. Mandibular pain. I got a pain in my jaw. Complete the table with words from the box. The first one has been done for you. In the trunk, we will have the abdomen, the loin, and the chest. In the upper limb, we will have the elbow, the wrist, the arm, and the finger. In the lower limb, we will have the thigh, the knee, and the leg. Unit 3. Parts of the body 2. The abdomen. The main organs of the body have ordinary English names, and doctors use these words, but when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary name. We have here an image with the names pancreas, duodenum, stomach, gallbladder, liver, right kidney, spleen, left kidney, a cross section of the abdomen viewed from below. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or small bowel, the large intestine or the large bowel. When speaking to the patients, doctor may refer to the anus and rectum as the back passage. Part B, the chest. The chest or thorax contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into two lobes, and the right into three. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, the bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored onto the side to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Label the diagram using words from the box. Look at B and opposite to help you. So number 1 is gonna be airways. Number 2 is gonna be lung. Number 3 is gonna be lobes. Number 4 is gonna be the diaphragm. Number 5 is gonna be the windpipe. Number 6 is gonna be the heart. Number 7 is gonna be the bronchioles. Match the conditions 1 to 8 with the organs affected, A to H, using your medical knowledge. So it's gonna be hepatitis connected to the liver, pneumonia is gonna be to the lung, nephritis is gonna be to the kidney, gastric ulcer is gonna be to the stomach, cystitis is gonna be to the bladder, cholecystitis, angina pectoris is gonna be to the heart, cholecystitis is gonna be in gallbladder, ulcerative colitis is gonna be the last. Complete the textbook extract. Look at A and C opposite to help you. Examination of the abdomen. To examine the patient for enlarged abdominal organs, first feel for the liver and the gallbladder on the right side. To do this, ask the patient to take a deep breath while pressing with the fingers upwards and inwards. Next, feel for the right kidney and then cross over to the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only felt if it is full. I'm gonna read the next part in the next video, and also I'm gonna read in Spanish the the units, the material.